Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Absorption of alcohol. There is no digestion prior to absorption of alcohol. 20% of alcohol is absorbed in the stomach and 80% of alcohol is absorbed in the small intestine. Factors which increase the absorption. Absorption of alcohol is increased in empty stomach. Absorption is increased if beverages are mixed with carbonated diluents. Like if soda is used with alcohol, then absorption of alcohol is increased. Then absorption is also increased if consumed with hot or warm uh, alcohol. Alcoholic concentration in a beverage is 10 to 20%. Factors which decrease absorption of alcohol: food in the stomach like proteins and fat, chilled beverages, concentration of alcohol less than 10% or more than 20%, and chronic gastritis. These will decrease the absorption of alcohol.
thank you and thank you for watching.